Hello, my name is Laura Mosqueda, and I'm delighted that we can show you what the next phase of your training could look like.
Keck School of Medicine, we pride ourselves on challenging paradigms and thinking outside of the box.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
The training you get here is as hands-on as it could be.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan for the first day.
We take on the toughest challenges, the toughest cases. We take on the biggest questions for research to try and make a difference and improve human health.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interest supersedes self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. Yes, that's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Yes.
These are the patients that, you know, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Dixon here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, But equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever.
We really want an inclusive environment where you can be the thought and the change leader on our campus.
If you come to USC, you will be part of a close-knit, collaborative Trojan community.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Hi everyone, my name is Peggy Sue and I am a third-year resident in the Otolaryngology Head and Neck Surgery Residency Program. I think that when people come to residency, they have different goals in mind, right? They might think, I want to be a great surgeon, I want to be a physician scientist, I want to be a good trainee and maybe become a teacher. My primary goal in choosing a residency was that I wanted to be the best surgeon that I could be when I finished training, and I wanted to leave training feeling confident in the tools that I've been given. And I think that USC Otolaryngology teaches you to be that surgeon, and that's why it's so strong. You hit the ground running as an intern. You start resident clinic day one with supervision, of course. And as a junior resident, I've already performed operations and been given responsibilities in the operating room that I thought wouldn't be available to me as even a senior or a chief resident. So that's been really exciting. We have a diversity of training opportunities. We work at Los Angeles County Hospital, which is one of the largest public hospitals in the nation. We work at Keck Hospital of USC and Children's Hospital of Los Angeles. Other strengths include the fact that we are very strong in our mentorship. Our faculty is very invested in you and they want you to get to where you want to be and provide you with plenty of resources for your research endeavors as well. As an intern, you start to see the bread and butter otolaryngology issues that bring patients to your clinic. And then second year, you really start to operate with your chief resident and with your attendings. We have done procedures across the board, head and neck, oncological surgical cases, otological cases, even some pediatrics. We'll do some pediatric ear tubes, tonsils, laryngology. We do facial plastics, big reconstructions for cancer cases. So it really is just, it spans across the spectrum. Even just yesterday, I worked the whole day with Dr. Michael Johns, who is one of our laryngologists, and he's very esteemed in the field. And we did 4 microlaryngological cases, including airway cases, and we ended on a challenging case for a patient with vocal cord paralysis in which we performed a thyroplasty and a retinoid adduction. So just even in one day, that is such a wealth of information that I got to learn as a third-year resident. When I was choosing a program, it was very important to me that we had attendings in every subspecialty in ENT. ENT is a field that's very diverse, and henceforth it has many different subspecialties. And you want to choose a program, or at least I wanted to choose a program, where we had every subspecialty covered with several attendings. And these attendings are incredible. They are esteemed in their own fields with their research and with their clinical advances. But it's not just that. When you choose a residency, you see the biographies on paper, you know the names, but for me, what ended up sealing the deal was the culture that these attendings embody. It's one thing to be a great surgeon and renowned in your field, but it's another to be a good teacher, and I feel like that's where our faculty excel. They are so receptive to you, they teach you all the time. I personally can literally text any attending any day, and they would be receptive. I don't feel nervous doing so. I staff patients, I ask them management questions, and they are more than happy to guide me. I'm a third-year resident, so that means that currently I am on a rotation called the Keck Gold rotation, and that is a rotation specializing in facial plastics, laryngology, and rhinology here at the Keck Hospital at USC. So in the morning, I'll wake up, and the first priority of my day is coffee. So I will get to the hospital maybe 5 or 10 minutes before rounds officially start, just enjoy a cup of coffee in the cafe and get in the right headspace for a day of operating ahead of me. And then I'll round with my amazing team of co-residents. We'll round on every inpatient on the Keck ENT service. Afterwards, we will go and get our first patient of the day ready for surgery and pre-op them before the operating room. And time permitting, we will enjoy a team breakfast for a couple of minutes. And then the rest of the day, my job is to operate and learn from our faculty. And after work, I'll go home. I live in Pasadena, so I'll try to do something fun, like walk around the area, maybe watch a TV show. I like to cook, so I'll try to cook dinner. But on the late nights when that's not possible, I know that I can get dinner here at the cafe, and it's covered under my residence stipend, so that's just a huge relief in terms of convenience. And then before bed, I will read to prepare for my surgeries the next day, and then the next day it all repeats. At Keck Hospital here, we can be pretty busy. So, for example, yesterday we did 5 cases in a day for just one resident and one attending. And sometimes if it's a big reconstruction case, big head and neck surgery, maybe 1 or 2 per attending a day, but it really varies. I think all of us have been very busy. The 4 residents on service here have multiple cases per resident per day. Our residency emphasizes wellness on multiple levels. At the institutional level, we have campus psychologists and therapists who are dedicated to the residents if you ever need to talk to someone professional to work through the complex emotions that come with being a hardworking resident. We also, at Los Angeles County, we have the Safety, Fairness, and Equity Committee, also called SAFE, which is actually led by our very own Dr. Tamara Chambers. She's also the Associate Residency Program Director. And it's essentially a formal way for residents to confidentially report events that have made them uncomfortable or concerned. And it's just this great initiative that makes us feel protected and heard. And that has been very valuable for all residents, not just ENT residents. At a residency level, Dr. Johns has instituted a wellness committee, which is focused on creating fun events and initiatives to make us well and to prevent burnout, which is very important for all of us. But I think that wellness being a priority in our residency is a fact because we embody it on a personal cultural level. The residents really enjoy each other and enjoy our time together, and what that meant pre-COVID were birthday parties, beach outings, didactics every week followed by happy hour. That's just a part of our culture. Of course, we've had to adjust that because of the pandemic, but we've still found ways to enjoy each other's company in a social distance and safe way. Just this past week, that meant a social distance boba run. A small group of us went to the beach for a social distance outing, and I played with a friend's co-resident's dog for some puppy therapy. You know, you would think that after working together so much, we would get sick of each other, but we really don't. We really enjoy each other's company, and not only am I grateful for the caliber of the program, but I'm grateful that I get to go through it with my friends. I remember actually the exact moment on my interview day when I thought to myself, wow, I have to come here. It was when we were taken on a tour of the ENT clinic at Los Angeles County Hospital, and we were just walking down a clinic hallway, just a regular clinic hallway with clinic rooms, and each clinic room has the bin outside of the door to hold the patient charts. But what was special about these bins were that they had the resident's name on them. And the tour guide explained to us that that's because it's the resident's clinic. You know, clinic at LA County is resident run. And so what this means is that you have your template in your EMR built out under your name. These are your patients. So I pull up the computer and I have Peggy Sue's patients every other day in LA County Clinic. You see new referrals, you book them for surgery, you do the surgery, you take care of them after surgery, and you create this gratifying physician-patient relationship. And that is so special because that is the closest replica that you will get to practicing as a physician after residency, and that's why I wanted to be here. And you don't do it alone. You can staff your patients with any attending, you can text them anytime, and they are more than happy to guide you on your management decisions, as well as in the operating room. And that kind of sealed the deal for me, that I wanted to be here.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.